now we're going to talk about planning as the second station from your API, assessment planning, implementation, and evaluation. So planning is a silent station where you will be asked to write 2 care plans for your patient, 2 suitable and relevant care plans for your patient. So now, what we're going to do is I'm going to read out the instruction or the scenario here on the paper, and we'll discuss this page by page. So first is, obviously, you have to put your candidate's name, as is with every other station. Our scenario is, Mira Abalone is admitted to the surgical assessment unit for close observation. Mira was transferred from the A&E where she had presented with abdominal pain and was treated using analgesia and antiemetics, and she is usually mobile and independent, but expressed that she may need help mobilizing due to pain, and Mira is scheduled for appendectomy today at 5:30 in the evening. Based on your nursing assessment, so from your assessment station, please produce a nursing care plan for 2 relevant aspects of nursing care suitable for the next 24 hours. This is a silent written station. Please ensure that you write legibly and clearly. You have 14 minutes to complete this station, including all the required documentation. Complete all sections of the care plan. Assume it is today, and today is 17th of February 2023, and it is 11:30 in the morning. So having read the scenario, it gave us a lot of clues already. The current situation of the patient in your planning scenario is that she is scheduled for appendectomy later at 5:30. So that gives you an idea already that the patient has to be safely prepared for the procedure, and that could be one of your care plan, because that's a relevant aspect of nursing care that you can give to Mira. And then the next one is, if you remember in her assessment station, Mira was in pain and she has a pain score of 6/10. So that's another relevant care plan that we can do. So for today's video, we will make a care plan for pain and safe preparation for theaters. As a tip, I keep telling our nurses or our candidates, as soon as you've read the scenario and when you've written your name, sign already the name, signature, and date on the 2 care plans that you will be using, because no matter how beautiful and pretty your planning is, if you haven't signed, printed your name, and dated it, it's gonna be a fail. And we don't want that. So on the second page, you will be provided with the patient details at the very top. So you've got the name of the patient, hospital number, address, and date of birth. At this stage, before you start your planning actually, you will be handed out your assessment paper. So the NUTH chart and the scenario that you used from your assessment, and you will use a black pen here as compared to the green pen that you used in your assessment. So whatever, if you've noticed that you missed something in your NUTH chart in your assessment, you won't be able to cheat, you won't be able to do and add on to that missing observation because you're using a black pen now. So that's the purpose why they're using different colored pens. So the nursing problem need, you always have to remember to just have a simple nursing problem or need. As simple as you have the subject, you have the verb, and then you have your problem or whatever you think is an actual problem or potential problem for the patient. Just remember your planning should be in a present tense because you're still planning. You haven't done it yet. You're about to do it. You're about to implement it. So that's why you're doing the planning station. So for pain, I will write my nursing problem need as Mira Abalone is experiencing abdominal pain with pain score of 6/10. 0 being no pain, 10 being worst pain, so that my assessor would understand why I use or why I have a 6/10. It just gives them a background that I know what I'm writing and I know what I'm doing. For the aims of care, it only means that it has to answer your nursing problem need. So if your problem need is pain, your aims of care is for Mira to be not in pain anymore. So how will you write that in a sentence? Mira Aballone's pain will improve as evidenced by pain score of 3/10 or lesser. Now, if you're gonna ask me, can you use 5/10, 4/10, that's absolutely fine, as long as you write it clearly in your aims of care that you want Mira's pain to improve. Now, re-evaluation date. So there's a lot of questions about, do I write here the frequency of the NUTH, or do I write hourly, or do I write whatever? But always remember, in your scenario in front, it's asking you to write a nursing care plan for 2 relevant aspects of nursing care suitable for the next 24 hours. So the re-evaluation date here is the re-evaluation of your care plan. So now, it will always give you a clue or a hint in front of your scenario if it's asking for 24 hours, 48 hours, a week, or a month, depending if your patient is in the hospital or in the community. If ever that there's nothing written on your scenario, use your critical judgment as a nurse, okay? So if you think that the patient's problem is urgent and emergency, then obviously you would want the re-evaluation of your care plan as soon as possible. So every care plan, every re-evaluation date will differ depending on your problem. But going back to my nursing problem need for Mira for abdominal pain with a pain score of 6/10, the re-evaluation date will be stated as Mira Aballone's care plan will be re-evaluated tomorrow, 18th of February 2023 at 11:30 in the morning, or if clinical condition changes. As you can all see in the planning that I did, I specifically put in there the word care plan just to make it as clear as a day as I can for my assessor when she's checking my planning papers. So my reevaluation is for tomorrow, and I included the date and I included the time because that's the next 24 hours. But what if something happens to my patient that I need to double check my patient, or I need to assess my patient? So that's why you have that dependent phrase of or if clinical condition changes. So if you have a different manner of how your OSCE facilitator taught you, then that's what you should follow. But with us, this is how we usually train our nurses to do their planning. And so far, it's been always successful. So now, going to nursing interventions. So here, I appreciate that, it will really be painful in your hand when you write, but I always give a certain points or pattern to how to write your nursing interventions. So I have about, I think, 9 or 10 steps, if I believe. Your first step would be, so the first, second, 8 and 9 step will always be applicable in whatever care plan that you do. Why? You will know as I discuss along the way. So the step number 1 that you write, or number 1 that you should be writing, should always be explains procedure and gains consent from Mira and her next of kin. Because whatever procedure that you have in place for the patient, it's the patient's right that you always explain to them and gains their consent for you to carry on with the treatment that you have in place for her. Step number 2, monitors and records NUTH score of 0, minimum of 12 hourly, or when clinical condition changes, and escalate as per trust policy. So this will differ whatever your NUTH score is. So for step number 2, this is where your NUTH score, PHQ 9, 6 CIT score, MUS score, NeuroObs, or GCS. On this part, this is where it should reflect. Why? because that's the purpose that you did that in your assessment. Now it's time to reflect it in your planning. So for the next nurse who's going to receive the handover, they will understand what you have done and how often you did the monitoring of the patient. So again, step number 2 is where your NUTH score, GCS, plain observation, must, PHQ, 6-sit score will be, and also you have to put the frequency. Okay? So now, we've discussed step number 1, step number 2. Now we're going to go to step 3 to 7. So what I keep telling our candidates or our nurses, you have to give at least 4 specific interventions related to your nursing problem need. Because I think at least 4 specific intervention is more than enough to write in your planning. But it's not limited to 4 specific interventions. But for this video, we're going to give at least 4 specific interventions. So one specific intervention for my pain is the continuous regular pain assessment using 0 to 10 pain scale 2. That's one. Next is, I will offer analgesia if prescribed and reassess after an hour. Remember, every time you give something, you administer something, you always have to reassess for effectiveness of that medication. Third is, encourages to do deep breathing exercises to relieve pain. Or you could also say, encourages to do diversional activities like reading, writing, watching television, listening to music, depending on what's the patient's preference. And lastly, I will refer my patient to pain team for further management. So I've given at least 4 specific interventions. So now I'm going down to step number 8. Provides call bell to summon help. And lastly, I will document all care as planned. And then I will print my name, I will sign my signature, and I will put the date today. So if you remember from what I mentioned earlier, step 1 to 8 and 9 will always be applicable to other care plans. That means step number 1 is explaining procedure and gains consent from Mira and her next of kin. My step number 2 is I monitor and record NUTH score of 0, minimum of 12 hourly, or when clinical condition changes, and escalate as per trust policy. What's my step number 8? Provides call bell to summon help. And my step number 9 is document all care as planned. So those 4 things already, they're applicable to any care plans that you do. What will only differ is the 4 specific interventions depending on what your nursing problem or need is. So some of the top tips that I could give you for planning: do not use abbreviation. Okay, so do not use INJ for injection, do not use S/C for subcut. You have to spell it out every time. And you always have to use measurable verbs. What do I mean by that? Like state, verbalize, communicate, list, describes, identifies, demonstrates, performs, and things like that. Avoid using non-measurable verbs like know, understand, think, and feel. Because why? You cannot measure them. How will you be able to evaluate if the patient know, understand, think? If you could phrase that in a very clear sentence, that's fine. But as a top tip, we rather use measurable verbs than non-measurable verbs. Another top tip for plannings: always include your referrals in your specific interventions. You could refer to a lot of multidisciplinary teams like physiotherapist to support immobilization, or chest physiotherapist, occupational therapist if your patient needs support in assessing patients' individual needs with regards to their activities of daily living. Discharge planning team, especially if it's a complicated discharge or complex discharge rather, if they need to be referred to social worker or private carer, things like that. Pain team, as we've mentioned earlier already, and falls coordinator as well to decrease the risk of fall of the patient, especially when they're admitted in the hospital. You could also do referral to respiratory specialist nurse, asthma nurse, if you have a breathlessness situation or scenario. You could refer the patient to diabetes team as well if the patient has a diabetes or as a past medical history or a current problem. You could refer the patient to dietitian. So remember earlier, Mira Abalone in the assessment station is vegan. So I offered to give vegan diet menu and also offers referral to dietitian should she need support or advice in terms of her vegan diet. Also, when you write a nursing problem, aims of care, and re-evaluation, you have to use a complete name of the patient. Do not just, let's say we have Mira Abalone. I'm not gonna write in there Miss Abalone, M.A., Mira, or Miss Mira. I would use the full name of the patient, Mira Abalones, because it's a proper and correct identification for the patient. And I think after that, we will just show later in the video or earlier in the video the other care plan that I did for Mira Abalone requiring safe preparation for theater. Another thing that I remember about planning, if you had an error or erasure, you have to erase it properly. And how do you erase properly that the test center will accept? So if you, let's say you have a certain word that you made a mistake with, put a single strike through line, at the top put error, and then sign. So you only have to use one single strike through because the assessor still needs to see what have you erased. You're not gonna put an open and close parenthesis or blacken it out. Just a single strike through, write the word error at the top, and then sign. And I think